Welcome, everyone, to Doing Business with a Servant's Heart. And this is your host, Steve Ramona. And this is part two of one of my favorite guests. We're bringing her back because she really cares and serves her clients and serves people. She wants to help people and she wants to make a change in the world and in a unique industry, the nutrition industry, to make us healthier with our own eating. Kelly, welcome to the show.
Thank you so much for having me.
No, I'm excited. So we talked about you went from working in a hospital to starting your own business. Are you crazy? Why would you do that?
Well, there was a lot of reasons for that. So when I was working in clinical, I would jump into the room and be like, hi. And I was Mary Sunshine in these rooms where people were sick. And I realized very quickly that the clinical setting was not an appropriate place for education. And it is a place for, making sure the chart is correct and you are giving the right, vitamins and minerals and this and that, whatever, but it's not a place for education. And people don't want to talk to you and be educated when they don't feel well. So that's why I really, truly got into my own practice so that I could sit down with them. I could take the time and they were comfortable, they were relaxed. And then the education really seemed to stick and we made more impact that way.
Yeah, I like that. And I love what you said earlier about energy. You come in all excited. Health is scary. How important is that when you're serving people in your business to have high energy, be so excited and positive?
Well, I really do feel like I am sunshine and butterflies because I love what I do. Not a lot of people can say they love what they do, but my days are filled with constantly educating, inspiring people, and bringing energy. So this morning, I've already done 2 TV spots, a webinar, meetings, and the best response of one of the TV spots was, "Your energy was fantastic." And so I think when we can bring that energy with food and we just put such a positive spin on it, it makes a difference in people taking in that information.
Yeah, and that leads to positivity because food's like, oh, Kelly, you're going to tell me not to eat this
Right.
and do that. Is it difficult? But you make it exciting. And then, of course, the result from them is exciting when they lose weight and their cholesterol drops or their diabetes goes or whatever that may be, right?
Yeah, so we really do feel that every food can fit into moderation, but once we educate on why you should be eating fiber and protein, once you understand the why behind it, you're more likely to make those changes. So it's not that you can never have your favorite piece of cake or whatever it is. That's not the point. The point is to truly educate on why the other foods are so important in the diet.
Well, that's exciting, but let's get into some deeper stuff here. You sound like a dietary company in industry. Are you really a healthcare company?
I love that question because recently we were denied a grant from New York State because they said that my industry was not looked at for growth. So I said, "What industry are you talking about?" And she said, "Dietary." I'm like, "Dietary? You mean like cafeteria had bonnets?" So this is where I said, ma'am, like, I'm sorry to let you know, but we are in the healthcare space. We have our degrees, our registered dietitians. We follow the same track as a medical doctor, and we do our internship and everything else. We have to get 75 continuing ed credits. And when we submit to insurance, we're submitting under the CPT code of medical nutrition therapy. So this is where understanding that we are in the healthcare space, we are part of the solution to the healthcare crisis,
Oh.
and we have massive room for growth. We just took on 200 dietitians at our show in Denver 2 weeks ago, just showing the scalability of a company like this and also the need of a company like this.
Yeah, and that's important, the need, because healthcare, we all know this is 2023. If you're listening a year later or whatever, it's getting worse. And that leads into mental health as well, right? How does
It
nutrition
does.
work with that?
Well, that's a great question. It came up today again because about a year ago, Blue Cross and Blue Shield said, "Kelly, we're focusing on mental health, not nutrition." And I had to stop my laughter because I was like, wait a minute, you really don't know the correlation? So in your digestive tract, you have 100 trillion bacterial cells. And by eating fiber and protein and vitamins and minerals, it actually, that is where down in your gut is where serotonin or your happiness transmitter is produced. That's then sent up to the brain to really work with that brain chemistry. And by getting in a healthful diet, you can truly reduce your risk of having depression, anxiety, and other forms of mental health issues. So it is a direct correlation between what we eat and how we feel.
Why is that not talked about more?
I don't know. I'm here today to get this word out, and the correlation between the two is just so significant. And there is more and more research coming out about it, but it's there. We know it. And so when I hear, well, we're just going to go, with the EAP program because we really are worried about mental health. Well, that's one piece of it. I'm not saying that we're everything. However, if you don't have your nutrition right, you can go to all the therapy you want, and it's not going to change the bottom line.
Tell us a story of a client, and if you got to be invisible, comes not say their name, but tell a story of where their nutrition got better and their mental health got better.
Across the board. So let me give you this example. We were able to change the nutrition at a prison. So I went in and was reviewing the menus and noticed that there was not any vegetables, protein, or whole grains on this menu. We changed it over. We were able to truly impact their mental health by adding in these nutrients and vitamins. We now have 3 years of statistics of how all of the grievances went down, fights went down, mental health went up, and just amazing of just showing that one in particular sector that we were able to control the food, but they also liked it. They liked the food more, and we were also able to stabilize blood glucose levels, cholesterol levels, and weight.
And depression too, because being in jail, I'm working with another gentleman. He's been in jail. Depression's rampant, of course, because where you are.
Well, before I got there, they were just feeding them simple carbohydrates, which doesn't spur any of that serotonin and can really truly starve out those gut bacteria. So you can see how it's not even just, adding in good nutrition. It's truly understanding that those foods were reducing serotonin levels, leading to more depression.
Why are you so passionate about nutrition?
Because I get to see the changes every single day. I still keep private practice. I just saw clients yesterday, 2 retired people. He has reversed his fatty liver disease. He's reversed his type 2 diabetes. He's reversed his high blood pressure. This couple has lost collectively over 200 pounds. They're walking together. They are smiling. I mean, I just cannot believe I get to see these results every day in my life.
Yeah, it enriches your life as well as theirs. That's a true servant. I so appreciate that. And I know we talked about in the show before, and it's been a few months, but I want to bring this up again. The fact with nutrition, how important it is to make it simple.
Yes. So this is where when I first started private practice, I would dump all the information on somebody because I was really excited to see them. And I wasn't a business person, so I felt bad about charging them. That's just our nature, right? Servants. So I realized it was not effective. And my amazing mentor, Cindy DeBold, she's like, Kelly, why don't we break up what you talk about into little sections? So basically little nuggets of information that have goal setting after. It has been the most successful thing we have ever done, and it's called our transformation program. We are applying for our first NIH grant through the National Institute of Health to truly show that with peer-reviewed literature that we are able to reverse and treat chronic disease. And it has been so impactful. We started this 8 years ago, and thousands of clients have gone through this program, but it's because it's simple, it's broken down, and there's goal setting for each and every week that they can take the information, put it into practice, and come back the next week. They say like, this was hard, this was easy. How do we work on this? And we go into the next lesson. So we're now training these 200 dietitians on this platform so that we can make sure that we're getting sustainable information out the same way every time.
The other thing that you said was so important. If somebody walks in and says, "Hey, Kelly, I'm here to lose weight," you go and you answer this, but that's not important. I want you to get healthier
Healthy.
first. Talk about that. I think that's so important.
Well, working in bariatrics for 3 years, a lot of emphasis was put on weight, but that wasn't necessarily the problem. The problem was a lot of those patients were doing fad dieting. They were not eating nutritious, rich foods, which means that they were getting those simple carbohydrates with no vitamins, no minerals, no protein. And so these people were literally starving in 400-pound bodies. So let's talk about the nutrition first. Let's get that right, and weight loss will be a result of that. However, if we're not getting the nutrition right, we're not helping the body.
And you have a statistic, I don't know if it's probably changed because it's been a few months since you've been on the show, that statistic of people losing weight without focusing on. Do you have a number for that?
100%. We have 100% weight loss.
If a client follows your mentorship, they all lose weight. And of course, you
all
can't.
lose weight. They all lose weight because the thing is, we're not focusing on calories. We're not focusing on weight. We're focusing on what are carbohydrates? How do we get in more fiber? What is the goal? Then we're on to protein. What kind of protein sources do we add in? Then we're on to fat. Then we're on to meal planning. Then we're on to dining out. And so all these weeks are adding up into these little changes that are making the difference. They feel better, their metabolism's working, their serotonin is built up, and it all clicks into place. You can see the light bulb turn on.
And I'm going to be a testimony. I don't work with Kelly, but I work with a lady that does the exact same thing. And I lost 6 pounds in 3 weeks. It was so easy because I didn't have to pull the scale out.
Right.
Going My Fitness Pal, nothing wrong with you, My Fitness Pal. You can sponsor me if you want. But going on an app and saying how much is an apple, how much is ground turkey.
Yep.
That's so important. So we've blown butterflies and sunshine in the air with this so far. Let's get to a negative in a good way. What's a failure you've had and how did you overcome it?
Well, right now we are looking for growth capital. So we are looking to hire some full-time managers, and it's been an interesting thing to see how, as a woman-owned business, in business for 11 years, that we still do not qualify for a lot of the loan opportunities out there, grant opportunities out there, and people believing that we have the ability for this growth. And so I think I'm kind of still in it, but I feel like each time we get denied feels like a failure, even though we're learning the next step or the next thing. So I do believe that all of the hardship in the last 11 years of learning and learning and learning, I am growing as a person. And I have 2 daughters. And so I'm teaching them about business and how it works. And hopefully my oldest is going to be graduating with her nutrition degree. So we'll be joining me. So she's like, "Mom, if you could get this figured out in the next 4 years, that'd be great." So, but
no pressure,
no pressure. But they have seen me struggle in the way of making sure policies are in place, making sure we have the right manager, following through. There's a lot of different things that I guess you could take as failures, but honestly, they're all learning experiences.
It's so great. I just love having you on the show because you're positive, but you also know we're fallible.
It's not easy. It's not easy. It is not easy.
Especially with a family.
Yeah.
So one thing I didn't ask the first time I want to ask today is your dietitians you're bringing on to your company and I work with people. You have a great servant attitude. You've got great energy. How important is the having the servant leader mentality for your dietitians when they work with the clients?
It's huge. So I recently became a CPU provider, meaning that because dietitians have to get 75 continuing ed credits every 5 years. So I now can teach my entire course to the dietitians for CPUs. And the reason why this is so important, and I think we are different in this way, is that training will go through ethics, how to chart, how to smile, questions to ask, how to bring that energy. And so we'll be training them through this program, and they'll also be able to get those continuing ed credits. So it's a win-win-win-win for everybody, that I can truly train them on how I react and how I deal with patients, and analogies I use, and the PowerPoints we use, and how to kind of utilize the platform and to get that person to achieve their goals.
And how important is that servant mentality with one of your dietitians? Maybe they're late, they made a mistake on a chart, whatever. Does a servant mentality kind of trump all those a little bit? If they didn't have that at all and they're great at all the others, is that a red flag to you?
Well, there has been a couple of red flags that have come up in the last year and two. So that's why we're doing the first two courses will be on ethics, because we are in the healthcare space and we do have to follow ethics very closely, especially when we're submitting to insurance. So this is where the first two training sessions will be on how do you chart appropriately, when do you chart, diagnosis, how often can you see a person, you can't see family members and submit it to insurance, you can't not chart. So these are some things that we have to go through very carefully, because it will reflect back on our company if they don't follow suit.
You take the extra step, one, to protect you, let's be honest, protect the company, but you're also protecting a dietitian too, right?
That's correct. Because if this is not followed, just so you know, they can be arrested for grand larceny. So
Really?
really, because they're submitting to insurance. So
Um,
this turns into fraud and theft. So this has been an interesting couple of years, and I again learned a lot, and I worked too hard to have, someone kind of take down the business. But through that learning, we have now put in protocols and things that we need to do to ensure that the dietitian is also successful, because that's the goal.
I like that. You're taking care of them by putting these things in so they
Right.
can be as successful as possible. They don't go past.
Right.
If they can't do that, then you be a servant and say, hey, we need to move you on. It's not a fit.
Right. And the thing is too, the most of the dietitians, we really do want to help people, but the back end can be really difficult to understand.
Mhm.
So if we can kind of take that for them, explain it to them, make it as easy as possible with charting and medical billing, and we help with all of that, that's the goal.
And this sounds so simple, like it happens all the time, but it doesn't. This is an outlier where you take the heart and the servant attitude to make sure they're taken care of. I love that because you care about your, not that
Yeah.
owners don't, but you take it to the next step, which I love. That's a true servant.
Well, we're trying to really bump it up. So, starting this next month, starting in November, we're going to be doing live classes with cooking classes, mental health, yoga, breathing. And a big part, I want my dietitians and my staff to be on those every single week to be getting that information. So, we preach health and wellness. We need to also follow that as well. So, I really am committed to getting our staff as healthy as possible.
My favorite question, I've been waiting all week to ask you this, is because I'm very curious. What's the future of nutrition?
I think we are just seeing the tip of the iceberg. I think that the fact that mental health kind of came first, and we're seeing, groups like Spring Health and Better Help, and they're now making revenues in the billions. I think nutrition is right on the footsteps. I think we really truly, if we bind together and we work together, we will see that we will be a part of that healthcare solution and really pushing forward. But it's going to take doing the NIH grants, proving our methods, proving what we can do, and really truly getting out there to market.
I like that because I'm curious because it's got to get better, right?
It has to, and we're not just dietitians in the hospital anymore. We are being able to work one-to-one with that client and reach them where they are. And that is a big piece. And that was also the reason why we went out to Denver, was to truly gain different specialties with dietitians so that you're getting the best dietitian for what you need. Also getting ethnicities, languages, so that you feel comfortable with your practitioner.
Yeah, that's great. Again, all servant attitude. That's why I love having you on, which leads to the question I like to ask. What are the characters or qualities of a servant leader in your mind?
I think compassion. Nutrition is
Mm,
a very touchy topic, and to not have that compassion for people that are struggling. And I really truly learned it in my first job at Cornell Cooperative, where people didn't really have the means to, get very expensive products. And like, let's look at that. Let's look at the next step when I worked at Hillside Children's Center or at Wegmans or all these different places. Compassion is a big piece to the servant.
I love it. It's well, you're on the show. We're running out of time, but I got a question that just came up. It's very interesting to me. How do we handle nutrition in poor areas of the world,
You
especially the
know,
United States?
It's so hard. I just got asked this question on Tuesday. I was on a panel for American Heart Association and they asked me this question. I'm like, of course they gave me the really tough one. So, it's a tough thing. However, by those first jobs I had, right, where Cornell Cooperative and then Hillside Children's Center, what I learned was teaching people how you can get healthful foods at a low cost. So you can buy a bag of frozen broccoli for 99 cents, or you can buy the regular head for $8. You can buy the canned peas, rinse them off, and you rinse off 40% of that sodium. But just recently, I was on with the FDA and talking about the front of package labeling. And I
Mm,
do think that if we are able to have like a stamp or a sticker that says like dietitian approved or nutrition approved or something that has fiber, has nutrients, we need to help the American public understand the difference between products. And I hope that that really does come up soon. They are looking at it, they are in talks, but right now it's just so confusing. So in those food deserts where there's not a lot of choice, if there could at least be a stamp or something that says like this is a better choice, I think education is key.
it's a great answer. You handled that tough question very well. Probably better here than the other show because I have a great show. Just kidding. But with that, I want to thank you for being on the show in part two. I've learned even more today than I did a few months ago. So thank you so much.
Thank you. I appreciate you having me on and getting this word out.
No, this is great. And watch the show a couple times because there's a lot of nuggets there you might have missed because I'm going to do the same thing. We'll see you all in the next show. Thank you.